Good afternoon, everybody. I'm happy to welcome you on our HDHL webinar, Understanding Food Marketing, Digital Food Marketing for Children, and also look at research and development of policies, and especially look at the recent developments there. So we're happy to join you. We have 1.5 hours. Let me see how I can. Yes. So this is an agenda. Speaking, we have 4 speakers. Don't worry, I will introduce them for you. And especially, this will take 1 hour. The last 30 minutes, there's ample of time for questions and answers, a Q&A. But I'll give you, let's say, a brief introduction first. And thanks for organizing this, the HDHL committee and the people from the Canadian Research Agency for organizing this. So a brief introduction of HDHL, Healthy Diet, Healthy Life. My name is Edith Veskens and I'm the vice chair of the management board of HDHL. And you can see here a very flattering picture. I don't look this nice anymore. My color of my hair has changed. I'm the vice chair of the management board. And in my daily life, I'm a professor of global nutrition at Wageningen University in the Netherlands and also dean of research at that same university. So what is HDHL, Healthy Diet, Healthy Life? Well, we started 15 years ago, funded by the Council of Europe and the EU, as, let's say, a joint programming initiative on healthy diet, healthy life, connecting the 3, let's say, balls you see here, the circles, nutrition, well, food, nutrition, and health. Because what we saw is that in policies, but also research, the food is more from the agricultural point of view, the health is more from the public health ministries and research offices, but we, nutrition, are an important bridge. So to link food and health. So actually, currently, it's still existing. It's an independent initiative of representatives of the various European, but also outside Europe, for example, Canada, ministries, funders, stakeholders, and scientists. And we want to align research and innovation actions at the European, but also more international level. So you see here at the left-hand side, our motto, healthy diets and healthy lives on a healthy planet for all. So currently we exist of 3 pillars. So we are a think tank to inform and influence European research agendas, other research agendas and the landscape. So we provide guidance. We still fund research because we think that it's very important, especially for early career researchers. And then we focus nowadays a little bit more on transdisciplinary, interdisciplinary research to build bridges. So it's still also curiosity driven, but also looking ahead in what policies we need. And there's an exchange forum, and that is also a very important part of our task, really build bridges and get the connections to the various stakeholders, collaborators, researchers, policymakers, and practice people. So we want to join research, knowledge, and experience. What we do, well, we have a website. You can see that here in the bottom below. You can take a look at it. We exist of a management board. We have an advisory board of scientists and also stakeholders. And we have a secretariat. And that is very important. It's held by ZonMW, which is the Dutch funder, the funder in the Netherlands. And many of the people of ZonMW are involved in helping the secretariat. So we fund projects that connect food and health. At the moment, we align with various partnerships through, for example, Food for Health. We have Clever Food and Food Paths Policy Brief. These are consortia on which we are connecting them, and we work on policy briefs on Horizon Europe. So that is, let's say, laying out the foundation for European-wide research. And also importantly, we facilitate science to policy workshops. One thing, public relations, we have our next wide daily, it's a one-day conference that will inform, inquire, and inspire. So we hope to see you there. It's in Brussels, a whole day with very nice policy lab sessions, but also scientific presentations, panel dialogues, etc. So one of the speakers from WHO, our chair of the management board, Eileen Gibney from Dublin, and various other speakers. So just take a note of that and please register. Okay, up to today, the webinar. We chose this topic because we feel it's really important in terms of, changing our policy, but our food landscape, our food environment for the good, for the benefit of all. And we know that already from a long time. So that's why I said introduction and some history. We know marketing is a key element of our current food environment. And especially for children, it's often present at schools and sport clubs. It's visible on television, and nowadays even more in the digital environment, the websites, social media platforms, online games, etc., etc. And we as parents, of course, are also very worried about some developments. And this is not new. Exactly, this is just an example from the WHO already giving some very good recommendations for marketing of foods and non-alcoholic beverages to children already back in 2010. But what you see now, the existing policies, it's still limited. A good example is Brazil, for example. They have a resolution for preventive health in 2014. But apart from that, in many countries, it's not there yet. Even in our country, we talk about it a lot, but there's always some pushback one way or another. So we feel on the bridge between science and policy, this is a very important topic. HDHL, we have been involved in this field already, and we have, for example, funded a large policy evaluation network a couple of years ago, and there was also the food marketing and the marketing to children, one of the important topics of conversation. And these reports were presented to the ministries, etc., hoping for us that something changes. But you will hear about this afternoon. So some discussion points for today. I mean, the Q&A is open, of course, but we thought relevant policy questions and needs, you can come up yourself with this in the second part of the webinar. Are there still any research gaps? If so, which ones? How about this pushback, for example, by industry? And how do we deal with this? And are there other barriers or bottlenecks? So many things to discuss. I close by some housekeeping things. The webinar will be recorded and it will be made available later on the HDHL website and on LinkedIn. Obviously, you can ask questions, and we ask you to do this through the Q&A button below in your Zoom frame. You're allowed to ask technical questions for each speaker. We will moderate the questions. So right after each presentation, there's about 2 minutes time for some technical questions, really pinpointing to each speaker, but more substantive and general questions, please leave them for the end for our Q&A, for which we should have at least 30 minutes. Okay, I'd now like to introduce the first speaker, and we are very happy she is here all the way from Calgary, Canada. Charlene Elliot, she's a professor at the Research Excellence Chair at the University of Calgary and Alberta's Children's Hospital. She focuses on food marketing and children's health, so that's really an important topic. And for example, she focuses on how marketing shapes children's food perceptions and, of course, informs policy and media. You will hear about her a lot. And also the literacy initiatives. And she has very nice new data to present. So, Charlene, the floor is yours.
Thank you very much
for joining us again.
Okay.
I need stop sharing. And you can share.
I will share.
I hope it works. Yes, if you can put it in presenter mode.
Yep.
Yes, it's there.
Yes.
Okay, I will disappear from the screen. Good luck.
Thank you. I would just like to begin by thanking you very much for the invitation to speak and to be part of this important conversation on food marketing policy and children's health. Given the webinar topic and the lineup of speakers, I'm not going to devote any time to establishing that food marketing to young people is pervasive, and a problem. We know this. Instead, what I'd like to do is provide some highlights from a multi-year study I've been leading on food marketing to teenagers in Canada and suggest what I think are some innovative contributions that emerge from the research approach and its findings, particularly when it comes to understanding persuasive power and identifying avenues for future research. So the impetus for this project reaches back nearly a decade. It was inspired by the federal government's healthy eating strategy and its commitment under that strategy to restrict food marketing to children under age 13 and to monitor food marketing to teenagers, partly due to concerns that advertising dollars used to target children would simply shift to teenagers post-legislation. This commitment to monitor food marketing raised an intriguing research and policy-related question, because identifying what counts as teen-targeted food marketing so it can be monitored is no easy task. I've spent a significant amount of my academic career studying food marketing to children, and in particular, child-targeted products in the supermarket. In this context, determining what is child-targeted is rather straightforward. Does it have Paw Patrol on the box, a unicorn? If so, it's fairly safe to say it's child-targeted. Yet, what exactly is teen-targeted food marketing? What indicators or criteria should we use to identify it so we can monitor it? We conducted a scoping review of the literature on food marketing to teenagers to get some guidance, but discovered a lot of inconsistency across studies, with terms sometimes vaguely defined or not defined at all. And for much of the research on the topic, it was adult researchers determining both the platforms to be studied and coding the food marketing techniques that they felt would appeal to teenagers. Beyond the challenge of identifying teen-targeted food marketing, there was also the problem of trying to keep pace with its rapidly evolving developments and trends. Food marketers are nimble, aggressively courting teenagers in their digital and real worlds. And they certainly can move more quickly than policymakers or researchers trying to study that marketing and the teenagers who encounter it. Researchers might be focused on one platform while the teenagers are off somewhere else. So, how were we to identify this marketing and to understand its persuasive power more fully? This was the backdrop of the GRAB-FM, or Grab Food Marketing Study. Instead of asking adult researchers or policymakers to subjectively determine whether a food promotion was teen-targeted, the idea was to ask teenagers themselves. So we spent 3 years developing a mobile app called GRAB-FM, and we recruited teenagers across the country to use the app for 1 full week. The instructions were very specific. Capture every instance of food and beverage marketing that they felt was specifically teen-targeted, and this was key. For each example, they indicated the product, the brand, and platform, as well as the specific techniques that they felt made it teen-targeted. And the persuasive techniques or indicators were provided in these little bubbles in the app that the teens could tap, with the option to add additional ones as necessary. And they were derived from a scoping review of the literature and follow-up focus groups with teens. So we've had several phases of this research, which provides really great insight into the products and the brands targeting teenagers and the persuasive techniques that they feel are most salient to them. I'd like to quickly highlight some of the key takeaways from the third phase of research. And the first item of note is the dominance of digital platforms when it comes to teen-targeted food advertising. 92% of the food ads came from digital platforms, with the top platform being Instagram, TikTok, and Snapchat. In contrast, television had barely registered as a platform for teen-targeted food marketing. It represented under 1% of the ads submitted. In fact, billboards were actually captured by teens far more frequently than television as a source of teen-targeted food advertising. Isolating out the ads specific to digital platforms, Instagram outpaced all others in terms of delivering food ads to teens. 40% of ads came from Instagram, with 7 out of every 10 participants capturing ads from this platform. And the digital palette promoted to teenagers across these platforms was primarily sweet and convenience oriented. The top categories were for beverages, fast foods, candy and chocolate, and snacks, and 83% of the ads promoted foods in these 4 categories. Not surprisingly, the top brands captured in terms of ad frequency represented big players in the multinational food and beverage market, with McDonald's, Coca-Cola, and Starbucks claiming the top 3 spots. However, it's worth noting that the percentage of ads for each brand was not high, with 6% or less of all of the ads captured. Instead, there was remarkable variation with the brand scenes, with 557 distinct food and beverage brands captured from Instagram, Snapchat, TikTok, and YouTube. Now, what were the persuasive techniques that the team said made it teen targeted? The most common technique reported across all platforms was visual style. And this is a term used to capture the elements that create the overall feel of an ad, such as color, font, or animated effects. 1 of every 2 ads uploaded was tagged for visual style. Teens also felt that special offers such as combo deals for fast food items or new or limited edition products were uniquely designed to appeal to them, a point that was also reinforced by focus group research we conducted, where the teens explained that they're generally broke, so combo deals are seen as targeted appeals. They also highlighted how they self-identify as early adopters for new food products and trends. And because of this, limited edition products or those tapping into Instagram crazes or TikTok memes really speak to them. For the top persuasive techniques of visual style and special offer, no differences were seen across gender. But for other techniques, such as humor, we could see some differences. Younger boys were more likely to select humor as an indicator, whereas girls were more likely to select celebrity, irrespective of age. Now, this barely scratches the surface, but there's 4 contributions that I'd like to highlight before I run out of time. The first has to do with deepening our understanding of food advertising's persuasive power from the perspective of teenagers, which, when compared to exposure studies, is something we know little about. Second, the project aims to move forward a theoretical framework for understanding this advertising under the broad constructs of selection and salience. Selection acknowledges the reality of digital noise. Teens, like all consumers, are inundated by commercial messages, but it does not mean that they notice them or they attend to them. We can use AI to scan the web and capture the billions of ads that exist, but we cannot use machine learning to tell us what ads the teens notice and think are targeted at them. So this study tackles the thorny problem of engagement by focusing on the marketing messages and the platforms that teens consciously engage with. Beyond this, understanding the persuasive power of an ad isn't simply a matter of capturing all the techniques in an ad and then tallying them up, because all of the elements of an ad are not equally meaningful. The power stems from what is salient to the audience. One celebrity endorsement or one humorous appeal might be far more persuasive than multiple techniques combined. And certainly this is something that was reinforced in our study, where the majority of teens identified one technique, visual style, celebrity, as the reason the ad was teen targeted. Third, it's often said that policy should not be conducted over the heads of those directly impacted. And including teens in this way also provides helpful pushback against suggestions that the advertising is targeting a different audience. For example, one industry critique submitted to the Senate committee overseeing the debate of Bill C-252, which was Canada's bill seeking to prohibit food marketing to children, was that the approach could inadvertently capture advertising directed at adults. With this approach to monitoring, teens are deliberately capturing the advertising directed at teens, so it cuts that kind of argumentation off right at the pass. Finally, this approach provides some insights into avenues for future research, the need to look at celebrity brand collaborations, for example, or the need for a focused examination of beverage types and promotions, since the research on adolescent beverage marketing has a heavy emphasis on energy drinks, but ads for energy drinks actually represented under 5% of the beverage ads teens submitted. So the advertising you might think of when you think of beverages, for example, and this is one of many examples, might be very different from what the ads teens actually see. And this is across the board with the advertising. I will conclude by just saying that it's unfortunate because the government of Canada is not currently advancing marketing to kids as a regulatory priority. So it's shifting the onus back onto independent research and monitoring to bolster the evidence base. So in this respect, I'm looking very forward to hearing my colleagues' insight about how to move policy into action. Thank you for your time.
Many thanks, Charlene. Lovely. Very good to see this, well, relatively new data for a group we tend to ignore a little bit. Well, not really ignore, but they are adults, not children anymore. And very important to have a good start around after puberty and adolescent age, also with a healthy diet and a healthy beverage consumption, of course. I see there's a question in the Q&A. Juliana, can you check? Erin Hobbin.
Yeah, there's a short question. Advertising standards currently require controls on ads targeting children and young people, but the definition of what targets children and young people is vague. Will your work be shared with Health Canada to inform an improved definition of the advertising standards?
Yes, actually, Health Canada was very generous in funding the second phase of our research. And so we have been working with Health Canada all the way along in terms of it.
Yeah, very good. There's another one. Would you be able to share a link to your research paper in the chat, please? A question from Melissa Dando.
Absolutely. And
Yeah.
there's a number of research papers with respect to this. And then there's a couple with the data that's are currently under review. So, yeah.
Yeah. Very good. Any other questions? Technical ones, the bigger things we do later? If not, we continue with the next presentation. Thanks again, Charlene. We continue with our speaker from WHO, Olga. I will need to check, find my notes. Olga Zhiteneva, she's the technical officer at WHO Europe, and she leads there the work on restricting marketing of unhealthy products to children. And actually, she is public health policy expert. Commercial determinants of health is she is working on, and also the psychology behind persuasive marketing. So, Olga, you are perfectly placed, I think, to explain us a little bit more the views and already the work done in the past, but also currently by WHO. So, please go ahead, share your PowerPoint, and I will disappear.
Yes, I'm trying to share my slides. I hope that you can now see them.
Yes, but can you put them in presenter mode?
Yes, can you see them now?
Yeah, we see everything.
Apologies, I just have one technical issue. Can you see slides now? Well,
yeah, we see everything, Olga.
Okay, the slides, right? Okay.
Yeah, just the slides. It's
okay. Yes. Hello, and thank you very much, Edith, again for the kind introduction and invitation to join today's webinar. Today, I will share how the WHO European region supports member states in protecting children from the harmful impact of food marketing and why this remains a critical public health priority. So marketing of unhealthy foods is a systematic driver of children's dietary preferences, purchase requests, and consumption patterns, contributing directly to obesity and diet-related non-communicable diseases. This work sits within WHO's broader mandate to reduce NCDs and address the commercial determinants of health. Before discussing marketing solutions, we must understand the scale of the problem. According to the latest data from the WHO European Childhood Obesity Surveillance Initiative, 25% of children aged 7 to 9 years across 37 participating countries in the European region are living with overweight or obesity. That means 1 in 4 children. This is not just an issue, it is a population level health concern, and these outcomes are shaped by environments, and marketing is a powerful component of those environments. So for many years, we have known what works to reduce the burden of non-communicable diseases, WHO has identified a set of interventions known as the best buys, policies that are highly cost-effective, feasible to implement within existing systems, and capable of delivering sustainable health gains. Importantly, in the 2024 update of the WHO Best Buys, restrictions on the marketing of unhealthy products are explicitly included into these recommendations. This is significant. Even in early frameworks, key nutrition targets such as reducing salt intake, for example, were extremely difficult to achieve without addressing marketing influences. When children are continuously exposed to advertising for products high in salt, sugar, and unhealthy fats, individual behavior change strategies alone cannot succeed. This is why addressing marketing is fundamental to effective NCD prevention. Global recognition for the harmful impact of food marketing on children is not new, as Edith mentioned in her presentation. In 2010, the 63rd World Health Assembly endorsed the WHO set of recommendations on the marketing of foods and non-alcoholic beverages to children. Through this endorsement, member states formally acknowledged that food marketing influences children's diets and called for national policy actions. So the mandate has been clear for over a decade. The recommendations urge countries to develop comprehensive policies to reduce children's exposure to marketing of unhealthy foods, establish monitoring and evaluation systems, strengthen collaboration and research. However, while this global mandate has existed since 2010, the marketing landscape has obviously evolved significantly, particularly in digital environments. In the WHO European region, our work on marketing is firmly grounded in the 2010 set of recommendations, and our ambition is clear: to support member states in making the European region the safest place for children in relation to all forms of unhealthy products marketing. And to achieve this, we focus on three core pillars. First, we map the marketing environment. Understanding the scale, channels, and techniques used, particularly in digital spaces, is essential for informed policy action. Second, we support countries with monitoring. Third, we provide regulatory support. This means technical guidance on policy design, nutrient profiling, legal considerations, and aligning national frameworks with international commitments. So speaking about our recent works on mapping, one major area of concern is digital gaming and live streaming platforms. These environments are no longer just entertainment spaces. They are sophisticated advertisement ecosystems. Children are exposed to highly engaging, brand-focused marketing techniques with very little transparency or oversight. We prepared a report on this. Another emerging issue is meal delivery apps. Recent research highlights how price, promotion, and targeted marketing strategies may disproportionately affect more deprived communities. Lower prices and more aggressive promotions for unhealthy foods are often concentrated in disadvantaged areas of cities. These platforms operate at the intersection of food retail, pricing strategies, and digital marketing, and remain largely outside traditional regulatory frameworks. And this brings me to an increasingly important regulatory gap: brand-only marketing. Some countries have taken strong steps to restrict unhealthy food marketing to children. However, most current regulations focus on product-level marketing. They do not yet fully address brand-only marketing, where a company promotes brand identity, values, or imagery without displaying a specific product. This type of marketing is increasing. To address this, WHO Europe established the Technical Advisory Group on Brand Marketing of Unhealthy Products to Children, and this group of leading experts provide scientific and legal guidance to support member states in closing this regulatory gap. Effective policy requires effective monitoring. WHO clearly states that all policy frameworks should include a system to ensure compliance. And where policies do not yet exist, monitoring is essential to build the evidence base for action. This means strengthening methodologies to assess children's exposure to marketing across television, online platforms, social media, influencer marketing, and emerging digital formats. In the WHO European region, we have developed practical protocols to support member states in measuring and tracking these marketing techniques. When we speak about regulation, we rely on evidence. A relatively recent systematic review commissioned by WHO headquarters examined the impact of policies restricting food marketing to children. And the findings are consistent. Government-led regulations are associated with measurable reductions in children's exposure to unhealthy food marketing. Voluntary or industry self-regulatory approaches show limited effectiveness and tend to leave substantial exposure unchanged. The evidence also shows that comprehensive policies covering multiple media and techniques perform better than partial restrictions. The conclusion from research is clear: policies must be strong, comprehensive, and government-led to reduce exposure meaningfully. In 2023, WHO headquarters released an updated global guideline on protecting children from the harmful impact of food marketing. The key messages there are the following. So first, protection must be comprehensive. Policies should cover all media, all settings, and all persuasive techniques, including digital, cross-border, and brand-based marketing. Second, regulation must address both exposure, it means how much marketing children see, and power, how persuasive and emotionally engaging that marketing is. Third, digital marketing requires specific regulatory attention. Unlike traditional media, digital marketing is personalized, data-driven, promoted through platforms' algorithms, and inherently cross-border. The WHO framework therefore highlights the need to strengthen legal definitions to explicitly include digital formats, address targeted advertising and data-driven practices, extend protections to adolescents, enhance cross-border cooperation. To support implementation, WHO Europe developed guidance on designing legislative responses. This document helps countries translate global recommendations into practical and workable legal frameworks. It outlines key design principles, including clear definitions of marketing and scope, the use of nutrient profile models, comprehensive coverage across media, including digital environments, enforcement mechanisms built directly into the law, and future-proof approaches that can respond to evolving techniques. The purpose is not to impose a single legislative model, but to provide a strong and adaptable baseline that can fit different legal systems across the region. And in short, it moves the discussion from why regulate to how to regulate effectively. And as example, we're going to hear later other countries which pioneered and in these regulations, but Portugal was an early leader in the region in introducing comprehensive mandatory restrictions on unhealthy food marketing and introduced mandatory restrictions on advertising of foods and beverages high in energy, sugar, salt, saturated fat, and trans fats to children under 16 years of age. The law covers television, digital media, print, school, and surrounding areas. A national impact assessment conducted in 2024, 5 years after implementation, shows that enforcement inspections reported high compliance rates in reviewed cases. The majority of detected violations occurred in digital environments, and between 2019 and 2022, more products began meeting the nutrient profile criteria, suggesting that the law may have encouraged reformulation. Overall, Portugal demonstrates that mandatory regulation is feasible and enforceable, while also highlighting the need to strengthen digital oversight and anticipate shifts into less regulated marketing channels. And finally, the 2024 WHO Europe position statement expands this work into the broader digital environment. It frames child protection online as a public health imperative, a child right obligation, a governance responsibility. Importantly, the document can serve as a clear and unified ask from governments to large technology companies, which currently shape much of children's digital environment. It provides a structured framework for governments to call for reduced exposure to harmful marketing, responsible data practices, transparency of algorithms and risk assessments, accountability for digital harms. And its core message is simple: children's health and rights must take precedence in digital design and governance, because the digital world is designed, and it can and should be designed in ways that protect children's health. And children deserve environments online and offline that make healthy choice the easy choice. Thank you very much for your attention.
Thank you very much, Olga. Very comprehensive and showcasing the good work that WHO is doing. Maybe I can start with a very practical question. I was very interested myself in the brand marketing. And you said there is now an advisory group, a technical advisory group. Do you know when they will be ready with their work and when they will have some report or advice?
Yeah, thank you very much. This is a big scope of the work at the moment at the WHO Europe. And so we anticipate that the report will be issued by the end of this year. We hope.
Great.
Yes.
Yeah. Well, no, great. Yeah, I'm happy. I'm looking forward to it. Yeah.
Thank you.
Juliana, you see questions in the chat for Olga specifically?
There's also one, I think, maybe more suited for our discussion later, but there's also one: how do countries monitor whether food advertisements are compliant with policies? Maybe you can give a very short overview.
It's important to have a policy to, be able to monitor, but we work with many countries which collect data prior the having a strong regulation, because it's important, even in terms of advocacy, to come with evidence. And so if I understood the question correctly,
Yeah, maybe I can also revise that question, because I had a thought of myself. For example, Portugal, they started in 2019, they have evaluated. But what if, just a practical question, how if a company doesn't listen to the law? I mean, is it continuously being monitored, and how is the company being punished? Does that happen?
Yeah, I think so. Our colleagues from Portugal are better placed to speak about that, but they have multiple authorities involved into the coordinated systems, and so they definitely have punishment mechanisms for companies.
Yeah. You should have an authority somehow, and of course, time. It takes an investment, and you need to have people to check. Although you can nowadays with artificial intelligence check the website quite quickly, probably. Any other practical questions for now, Juliana?
No, I think we can move on.
Okay. Thanks a lot, Olga. We'll come back to you later, and we continue with our third speaker from the UK, Professor Jean Adams. Welcome, Jean. She is professor at the University of Cambridge, and she focuses on how environments shape what people eat, including evaluating large-scale policies and the sugar tax, for example, menu labeling, marketing restrictions. And she has worked with, let's say, experimental methods and natural experiments, and also uses systems thinking. We are very curious about that, Jean. You can share your PowerPoint or your slides.
Thank you. Thank you for the introduction. My methods are more natural experimental than experimental.
Yeah, I can
So
imagine.
can you see the right screen?
Yeah, the right one.
Yep, okay,
Yeah.
perfect. Okay, so as Edith said, my name is Jean Adams, and I'm a professor of diet and public health at the University of Cambridge in the UK, where we have just implemented new regulations on food marketing, which I'll talk about today. So as was mentioned, my work focuses on the influence of the environment in its widest sense on what people eat and how we can change the environment to support people to eat better. And of course, food marketing is part of that wider social, fiscal, and digital environment that we've created for modern society. So just before, well, as I start, I just wanted to briefly remind you about the difference between food marketing and food advertising. So marketing is all the activities that businesses engage in to create, to communicate, and to deliver value to their customers. So it's a creative activity, but it's also strategic and it's integrated. It's lots of different things going on simultaneously. And it's often captured in terms of, you might have heard of this, the 4 Ps or sometimes the 5 Ps or even the 7 Ps of the marketing mix. So I've listed 5 here. So creating an excellent product, setting it at the right price point, promoting it through advertising, sponsorship, and other messaging, making sure it's in the right place for your customers to engage with it, and providing great customer service. These are all part of marketing. So crucially, advertising is only one part of the marketing mix. And I will try hard today, as I do always, to try and remember not to conflate advertising and marketing, but I may still make that mistake and do point it out if I do. So it's clear that many aspects of marketing, as other speakers have talked about, influence consumers' preferences, their purchasing and their consumption. And essentially that's what it's for, right? It's to drive a positive engagement with products that eventually lead to purchasing. As a public health community, though, we've started to notice that this seems to be a key influence on what people choose to eat on their diet. And so that's led to a move to start to restrict marketing of the least healthy foods and drinks. And I think this has started one of my very first projects that I led early in my career was an evaluation of restrictions on less healthy food advertising to children on TV. And those were implemented, I think, in about 2008. So the public health response started with these very specific restrictions on some types of marketing. Specifically, we started with TV advertising, but of course we're getting more sophisticated. But as I said, marketing is a strategic and an integrated suite of activities. And the balloon theory of marketing suggests that when you squeeze marketing in one place by, for instance, imposing restrictions on TV advertising, just like when you squeeze a balloon, it expands in other places. When you squeeze marketing in one place, you should expect expansion in other places. So industry might adapt to restricting advertising on TV or online by changing prices, by developing new products that can be advertised, and doing lots of other things. Advertising in media channels that are not restricted. And all of these things might happen at once and more might happen that we can't predict. And I think this growing realization of industry adaptation has led to this understanding that to adequately address the public health impacts of food marketing, we also need to, we need to fight fire with fire. We also need to be strategic and integrated in our regulatory responses. Which is all a very, very long introduction to the UK restrictions on digital food advertising were originally proposed as part of a bigger suite of interventions on food marketing of less healthy foods. They weren't comprehensive. There could have been many more things, but there was more than just the restrictions on online food advertising. So there was volume-based, so the proposals was that there would be restrictions on volume-based price promotions. So that's things like buy one, get one free or 3 for 4, anything that encourages you to buy more than you intended to via a price promotion. There would be restrictions on location-based promotions. So that's putting less healthy foods in what are called kind of high value parts of supermarkets and grocery stores. So particularly aisle ends, checkouts where people linger, and the store entrance, so the lobby, where in the UK there's often kind of great piles of, before these restrictions, it tended to be beer and big boxes of chocolates. And alongside those in-store restrictions, which were also apply online to online purchasing, there's restrictions on TV advertising of less healthy food between 5:30 in the morning and 9 o'clock at night, and that's often called the 9 p.m. watershed. And then a total restriction on online advertising of less healthy foods. It's often called a total ban, but we'll get into the details of why it might not be perhaps that. So this group of interventions was originally proposed in a government obesity strategy in 2018. And at that time, they said they would introduce the price and location-based promotion restrictions quickly, and that they would consult on the TV and online ad-based restrictions. And in fact, later that year, they did do a consultation, a technical consultation on how might we do this, how might we define online advertising, things like that. Then we didn't hear anything for a while. Civil service colleagues were very quiet about what might be going on behind the scenes. And in fact, during that time, we had quite a lot of political turnover. We didn't have a change of government, but we had a rapid succession of a number of different prime ministers. Then in 2020, we had a new obesity strategy that was published. And this time it was prompted by the Prime Minister at the time, got COVID, and he got quite ill and he ended up in intensive care. And he attributed how ill he had got with COVID to his overweight. And that was used as the rationale for why we're going to have a renewed focus on obesity policy. So there was a restated commitment to all of these policies, but no timelines again. In fact, it was another 2 years before we heard anything more about what was going to happen with these policies. And in fact, at that time, we got legislation with implementation dates stated that was going to be late 2022 and early 23. So those were legislated for and passed in Parliament. And then, in fact, we got a series of delays, and these needed additional legislation to delay implementation, which I always thought was just a bit crazy, that we were using up parliamentary time to essentially do nothing. So this went round and round a little bit. Eventually, we had the location-based bans implemented in October of 2023. We had the price promotion restrictions implemented in October of last year, and then just last month, the TV and the online ad bans have been implemented. So we understand that some of this delay was particularly due to concern with rising food prices and cost of living, and a feeling that we shouldn't be restricting things that help people afford food. So there was some of that. And also we think that some of it was due to industry lobbying and their preference for we didn't have legislative restriction on marketing. We had a change of government 18 months ago, so in summer of 2025, and one of the things they actually campaigned on was implementation of the TV and online advertising bans. And you can see one of the visuals they used in their campaigning in this slide. So just to be really clear what's happening in the UK, the online and the TV, the restrictions on online and TV advertising of less healthy food apply to businesses which have 250 or more employees. So this is the definition of a large business in the UK. They apply to any identifiable product which is considered high in fat, salt, or sugar according to our nutrient profile model, and is also in one of 13 categories. So the nutrient profile model is supposed to apply across the whole food supply, but there's been this government decision that we will only focus on these 13 categories, which are proposed as those where the most food advertising is. So the TV adverts that are in scope are anything broadcast on live, on-demand or internet TV under UK jurisdiction that is shown between 5:30 in the morning and 9 o'clock at night. So if you watch catch-up TV, as long as you watch it before 9 o'clock, the restrictions will apply. The online adverts that are in scope are all paid for advertising, including all the other types of TV that you get on online. It doesn't apply to adverts that you find on a company's own website, because this assumption is that if it's on your own website, if an advert for McDonald's is on the McDonald's website, that they're not paying for it. That's part of their standard communications. And as I said, the implementation was last month. Okay, so that's great that after 8 years, we've finally managed to implement all 4 of these policies, maybe not quite in the kind of integrated way that we'd all hoped for all those years ago. And it's sad that it took us so long to get here, and maybe lots of my colleagues across government, advocacy and research will agree that it often felt like we were going around in circles, trying to justify these policies and writing them into policy documents, and then having to have the same policy document written again and again. But it's maybe obvious from what I've said, what some of the key limitations of these restrictions are, even though there was so much work that went into making them happen. So they specifically apply to products and not brands. So a product has to be identifiable as high in fat, salt or sugar, according to our nutrient profile model. And in order to be identifiable that way, you have to have the product, right? So this top advert here for McDonald's farmers, that wouldn't be covered by the restrictions because there's no product shown, even though, I mean, I haven't done an up-to-date analysis of McDonald's products, but I assume that many of their products are HFSS. This advert for a Big Mac, though, again, I actually don't know whether a Big Mac is still HFSS. Assuming it is, it would be covered by the restrictions. The other big limitation is that the restrictions on advertising apply to TV and online advertising only. And Charlene's talked about lots of that digital is a big space for food advertising, but there are other spaces, and particularly we think that there's been a big increase in outdoor advertising over the last few years, perhaps in response or anticipated response to these new restrictions. So because these interventions are so new, we don't know how they're going to play out. So I've hinted that there will be some industry adaptation, but we don't know whether the adaptation is going to entirely neutralize the potential public health benefits and where we'll end up in that balance. But we've been lucky enough to win funding from one of our big national funders to evaluate the intervention. And in fact, we actually got a small grant a number of years ago when everything was moving very rapidly to develop our evaluation plans. And at that time, we did what I would now look back on and say was a very rudimentary version of group model building, where we had spent some time with a variety of different stakeholders, kind of crowdsourcing what they thought the potential impacts of the interventions might be, not just in terms of purchasing and diet, but on the wider society, on different aspects of policy. So we came up with this diagram. Which you can see in the paper in more detail. The details of it are not really important, apart from just to point out that we think that there might be a lot going on when you implement these sorts of restrictions. And this helped us develop a multi-component evaluation, which is summarized in this diagram. So this is kind of not a consort diagram. Like a consort diagram is a really standard way that you describe a randomized controlled trial. We're not doing an RCT, but we wanted a diagram that summarized things anyhow. So this is based on the concept of work package 0, which was developed by Miriam Alvarado. And it proposes that when you have these multi-component evaluations, integration of findings is really important so that you can say what we learn as a whole rather than just, well, we saw impacts on reformulation, but we didn't see, for instance, impacts on GDP, that we want to be able to tell an integrated story. So the idea of Work Package Zero is that we come up with a theory of change, which I've just shown you, and then we use our findings to develop that theory of change as we go along. So we say some links are strengthened based on our findings, some links based on our findings we don't actually think happened at all, and actually there might be new things that we uncover that we hadn't hypothesized would be there in the beginning. So the evaluation has 6 work packages. The first 4 follow a spine of a fairly linear theory of change, where we'll look at the impact of the interventions on what marketing there is for less healthy products, how available they are in grocery stores and in the out-of-home sector. We'll then look at impacts on purchasing, and we'll use that to estimate health impacts using health impact modelling. Then use that to feed into a much wider societal economic modelling, which attempts to kind of balance any benefits in terms of health to any harms to the whole of society. So that might include industry are always saying that these sorts of interventions will have a negative impact on employment. So we'll be able to look at that. But we're also interested in public awareness and acceptability, because we think that these are not just key determinants of implementation of this sort of policy, but also in terms of longevity of the policy, just like whether or not it gets repealed, and also enforcement. Like if the public are really behind a policy, then they'll start to police it themselves. We'll also be looking, I told you about this really tortuous timeline of getting from the very first suggestion of these policies to actual implementation. We're going to try and understand what happened there to learn how we can do policy better in the future, if there are any lessons to be learned. So we just started this project last month that runs for 3 years. I've, of course, got no findings to share with you today, but I'm very happy to keep in touch. I can update in due course. And I'll just end by saying thank you so much to NIHR, who stuck with us through a very tortuous commissioning process as interventions were repeatedly delayed, and to my collaborators who I'm really looking forward to working with. Thank you.
Thanks so much, Jing. Really great. In view of time, there are some questions, but I also need to give Liv some time. Urgent questions, I see some questions, but they are quite elaborative, and I think they can easily be moved to the Q&A because they relate to some broader things. Are you okay with this, Juliana?
Yeah.
I'm just taking
Yes,
my liberty
that's a great idea. Yeah.
as the chair. Okay, Liv. A very exciting new project by Jean, by the way, so we're sure we come back to that. But I'm happy also to introduce Liv Elin Torheim from Norway. She's a senior advisor on public health nutrition at the Norwegian Ministry of Health and Care Services. So it's good to have someone, well, who understands research, but now is on the other side of the table, on the policy side. And she was involved in developing Norway's new regulation to restrict food marketing targeting children. So we are very curious also to hear about your experience so far, Liv. Can you share your slides?
Yes, I will try to do that. Let's see.
And again, Jean, we come back to you with these questions. Don't worry. You can already take a look at the Q&A to see them. Yeah.
Can you see it now?
Liv? Yeah, you can go on. I will disappear. Good luck.
Great, thank you. Yes, so good afternoon or good morning, some places in the world as well. Thank you so much for the opportunity to speak here about the relatively new regulation, which bans the marketing of unhealthy foods and beverages targeting children under the age of 18. Let me see. Yeah. So this regulation was entered into force in October last year. And I'll give you a little bit of the background for the regulation because it replaced a self-regulatory scheme that has been in place for the past 10 years. And weaknesses of that self-regulation included that it only covered children under 13 years of age, and it lacked enforcement mechanisms beyond naming and shaming. And evaluations of that self-regulatory scheme concluded that it was not effective in protecting children against marketing. So the evaluations that had been done together with a stronger scientific case was such that policymakers and health officials wanted stronger protection of children in line with WHO guidelines that we heard about, and also in accordance with the Convention of the Rights of the Child. So the regulation was prepared and supported by a comprehensive package of background material, and it was submitted for public consultation. And that happened in, I think it was in August 2024. And during the consultation, so it was open for everybody to comment on and give their view on the proposed regulation. And most NGOs and municipalities and public health stakeholders, they were in support of the regulation, but many actors from the food industry were critical. Yeah, and one particularly vocal group has been those involved in sponsorship of events or of organizations. Yeah, and we already heard about the WHO guideline from 2024 on policies to protect children from harmful marketing, and it was important when preparing the legislation. And as we heard from Olga, the guideline was based both on reviews of the scientific literature, but it was also based on the recognition that marketing of unhealthy food violates the children's rights in accordance with the Convention of the Rights of the Child. And in preparation of the guideline from WHO, they commissioned several reviews. And since these reviews had been recently conducted and were very comprehensive, we saw no need to replicate the same kind of systematic reviews for our regulatory work in Norway, and we could lean on this evidence base from WHO. So I'll just show 3 examples of the reviews that were prepared. There was one narrative review summarizing the evidence on the nature, extent, and impact of food marketing, documented that children are widely exposed to prevalent and persuasive unhealthy food marketing. And it was a systematic review by Boylan et al., documenting causal evidence, which was mainly based on RCTs, and showed that food marketing harms children's diet-related behaviors. And then this second systematic review that also Olga mentioned, which showed that mandatory and comprehensive policies are needed to effectively restrict marketing to children. So this kind of evidence was important for the case when explaining the need for developing the regulation. Research in Norway has so far mainly been focused on the extent of marketing, in addition to 2 evaluation studies of the self-regulatory scheme. And this is an example published in 2025, where the Research Institute Consumption Norway at Oslo Metropolitan University studied influencers that were popular among youths. And they collected postings by 16 influencers over 3 months. And about a quarter of the posting were ads, and 35% of these again were for foods and beverages, and most of these food and beverage ads were not in accordance with the WHO nutrient profile. Yeah. And there was also more unhealthy food ads among foreign influencers. And the same research groups, they have collected screen recording among youths now, and these are currently being analyzed. And this will serve as a kind of baseline for the regulation to see the impact, the potential impact on exposure. So some of the main factors that contributed to the development of the regulation has been an active civil society, especially through the Norwegian NCD Alliance. The civil society played a key role. They highlighted that the marketing of unhealthy food is a problematic issue to the public. It's important to get the public to know the importance of this, so they're prepared and they will support the regulation. And they used media and they conducted surveys, and they also raised the issue in their contact with politicians. A second issue or important factor was that we had already worked a lot with preventing marketing of unhealthy food to children in Norway. There was a similar round of proposal of a regulation in for about 10 years ago, and that regulation didn't come through, but we had that self-regulatory scheme instead, and that has been in place for over 10 years. So we had a decade of experience to build on when putting together this new regulation. And this, together with all this new research, contribute to that we could develop a well-worked-through regulation. And also there has been important political support, which was a key factor for adopting the regulation. So the current Norwegian government has prioritized this work, and they often have to stand up for this regulation when there's quite heavy pushback from some parts. Okay, so I'll just say some things about the main content of the regulation. So the objective is to promote health through prevention of diet-related health problems and diseases in the population by protecting children from health-related undesirable marketing. And in the regulation, there is a definition of what constitutes children, and this is under 18 years old, in line with the Convention on the Rights of the Child. And the marketing is a broad and technology-neutral definition of marketing, which also includes digital media. What does this? Yeah, and we also have a definition on sponsorship. And this latter is defined separately because it is partly exempted from the marketing, which I will come back to. And when it comes to products that are covered by the ban, these are quite close to the previous self-regulatory scheme, but it's also in line with some of the categories in the WHO nutrient profile model from 2023. So on this slide, you can see the categories covered by the ban, and it's split in two. And on the left-hand side, you see categories where no products may be marketed towards children. And these are products that we consider to be the most unhealthy products. And on the right-hand side, there are categories where we use nutrient thresholds to identify sort of the most unhealthy products within these categories. For example, for breakfast cereals, total sugar and dietary fiber content are assessed to determine if the product is covered by the ban or not. And in the regulation, we have included a list of marketing activities that we consider to always be particularly directed at children and therefore always covered by the ban. I think because of the time, I think I will not go through each and every of this, but just to give you an idea how it's set up. I can just mention that there is a general assessment that has to be made to decide whether the marketing is particularly targeting children with some suggested criteria. And we already heard from Charlene in the first presentation that there are challenges related to how to determine whether an ad is targeted to children and young people. So, this. And I mentioned also there is an exemption for sponsorship for non-profit purposes, except concerning the most unhealthy products, the products on the left of the list. Yeah, and also there is exception for a trademark for the brand. And we also heard about that from Jean. That can be problematic. And when it comes to sponsorship, there has been quite a lot of debate about that in Norway. Well, in general, several NGOs find that these exemptions are watering out the regulations and that it makes it too weak. But the industry and the Norwegian Confederation of Sports, on the other hand, they find that the exemption of the sponsorship definition is too narrow, and the sports community is concerned that they will lose revenues. And yeah, this is something that the Norwegian, well, in the evaluation that I will come back to, it will be looked into. So, and there was previously a question about sanctions more in general, so I can say a little bit about that for Norway. So the Norwegian Directorate of Health is appointed supervisory authority. And if the directorate finds a marketing activity to be in breach of the regulation, they may order the responsible party to rectify the situation within a time limit. And they may introduce a coercive fine if the order to rectify is not followed. And then there is an appeal body, which is the Market Council. And currently, the directorate focuses on giving good guidance and answering questions from the food business actors about the regulations. And the directorate has already also received several concerns and tips regarding marketing activities that they're looking into that might be in breach of this. I can also mention that the plan is to introduce a fine in 2027. And there will be an evaluation. The Norwegian Institute of Public Health has been assigned to conduct the evaluation, and they have prepared a comprehensive protocol. And the plan is to look at the impact the regulation has on the marketing extent, power, and exposure, and the impact it has on dietary behavior. And they will look into potential unintended consequences, for instance, when it comes to the sponsorship of sports events and so on, and on experiences from implementing the regulation. And in addition, they will also look into the involvement of children and youths. But some of these elements are dependent on funding. Yeah, I see time is flying, but I just wanted to tell about a seminar that will be held by the Norwegian Directorate of Health together with Joint Action Prevent NCD to sort of celebrate progress on regulating unhealthy food marketing to children in Norway. And it's both in Oslo, but it's also possible to follow it as a webinar. So I can try to add the link to this in the chat if you're interested. And it will not only be about Norway in this seminar. So it could be interesting for more. Okay, so thank you for your attention. And I want to thank Sandra, who has helped me developing this. And she has been more involved in developing the regulation together with other colleagues here at the ministry. Yeah.
Yes, Liv, thank you very much. This is such an interesting example again of a quite successful endeavor. And in view of time, there are some specific questions from you in the Q&A on some literature, some research you used, but I'd like to go immediately to a little bit more general overview. And all the speakers, please put on your video so I can see you. We had a really exciting program, and it really fits all quite together. And if I summarize, WHO has done a lot and have produced a lot of good, useful reports, which in the UK and in Norway were able to be used, but in some other countries, maybe Canada, not yet. But what I see there as maybe something you highlighted, Liv, what was there present, not only previous research, etc., and also your past experience, but I clearly saw the political support, the political will. And also, Jean, you mentioned that this was initiated by the fact that your certain white-haired prime minister felt suddenly that there was a need. So the politicians, the politics play an important role. I think, and maybe I can go directly to Charlene, because I know your frustration, Charlene, that you have done so much work. We have done so much work as a community. And in some countries, my country, but also perhaps your country, we are not that far yet. So how is that with the political will as a bottleneck?
Well, I would say that, it's interesting. The commitment to moving forward regulations on marketing to kids was reinforced through multiple Minister of Health statements for years. And so it's just, we've had a shift in leadership, and right now they're not advancing it as a regulatory priority. And so I guess, yes, as a researcher, it's interesting because we do have a strong evidence base, and it's kind of hard to go back to, or we're going to continue on as independent research to support the policy. But yeah.
Maybe Jean, the political will. I guessed, right, that was important in the UK situation. Can you elaborate that on a little bit more?
Yeah, I think that's right. I think, though, that diet and nutrition are always kind of low priority policy areas for a number of reasons. Like, I think there's a hesitation for politicians to get involved in something that's often considered to be a family or an individual responsibility, and like they don't want to go there at the risk of being labeled nanny state.
Yeah.
They also, like, there's risks also from industry of being labeled anti-industry, and also just getting a lot of negative pushback from industry. And there's very little kind of benefit, I think, that they see to it. So it has to be something that's done early in an administration when they've got a lot of political capital, when there's a lot of time to do other stuff to kind of bring themselves back up when they're in control of their government. And I think that because it's kind of politically just not very attractive, the opportunities to do this stuff are very limited. And I think that's one of the reasons why, that I think the delays in the UK speak to that. If you get into, we had a really tumultuous time politically in the UK during all those delays. And then as soon as we had a new administration, bang, we did it.
Came back. Yeah.
And so I think that like we probably as a community also have to be alert to the politics of that there are windows when this will work and other times when we will just go around in circles.
Yeah. And Liv, that this pertains to you as well, right? You were lucky in that sense that you had now a government and the political support was there.
Yeah, I started in the ministry just 1 year ago, and then it was all laid out. So I came to the ready-made regulation.
Maybe I can ask then Olga, because WHO, obviously, you are financially supported by all kinds of governments. To what extent can you help us? I mean, with a very good report also on, let's say, the legal issues and so on, the building blocks are there. How do you see the political will in the various European countries? What do you know in WHO Europe about this?
Thank you, Edith. It's a good question. We actually support 53 countries of the WHO European region, and I like to compare our work with consultancy. Like if a country wants to work individually, we're happy to do so. And they come and ask support. Like, for example, we used to work with Norway with different institutions, and we tried together to conduct some researches, then we would realize that this doesn't work. How can we change? And it was very beneficial and interesting work. And also regarding the political will, we try to inspire countries by examples like what Norway did, like
Yeah.
what the UK is doing, and also
Yeah.
Portugal. We don't want other countries to invent a bicycle, that's for sure. And for that, we have, for example, a marketing network meeting where all countries, I think all 53, can join, and it's a new meeting, and we're actually organizing it this year in Oslo too. And after that, we're going to celebrate the success of Norway.
Yeah. Nice.
And and we have all the kind of experts, everyone you could see on all these publications and in reports, and partners to exchange experiences on everything, monitoring, regulating, and by sharing evidence and legal approaches, and showcasing that it's possible. I think this is what we can definitely do, and work individually into development and gaining more evidence.
Mm-hmm. I am also watching the Q&A. This question is for Jean, but I think this relates to everybody. The question was by some of the attendees for Jean. What strategy did you use to overcome the pushback by industry? I don't know if you used that personally or what was done in the ministry.
Wasn't me personally.
No, but what do you think?
Well, certainly some concessions were made. So the exemption for brand advertising was a late introduction, like really late in the day. I think also that industry knows that this stuff is going to happen, and what they're trying to do is delay rather than prevent. And so eventually we kind of get to the end of, right, we've done that. Like now we're going to move on to the next step, which is implement. So I think it's a little bit of that. And they probably, like I've just explained the politics of it, they probably knew that this was the moment where they would not be able to push back more.
Yeah, good. Any other ideas? Liv, how did you do in Norway? Pushback from industry? There was a question also, especially for you, for let's say foreign industry, foreign traders, because like a small country, Norway, Denmark, there's a lot of advertisement or marketing through external parties, not perhaps under your control.
Yeah, and that is a challenge, digital marketing from
Yeah.
external platforms.
Yeah.
So that is why it would be good if there was a more universal ban on marketing.
EU-wide.
Yeah.
Yeah. Yes.
Yeah, and like Jean also said, I think there were a discussion with industry, and to see how, for instance, with the sponsorship challenge, of course, it is a concern if a football club or a big sports arrangement loses important or money from ads, and we can say that but they should just get ads, different commercial supporters, but maybe it's not that easy. So there are some challenges that pop up.
Yeah, smoking is already not allowed, right? And alcohol. So I think this is their last resort. Yeah. I never thought about it. Indeed, that sports communities also could be a pushback. I always thought we were quite aligned in, achieving healthy lifestyle for everybody. Yeah, quite interesting. Charlene, how is this in Canada? You look at American websites, so how can you deal with that?
Well,
if you're a Canadian.
Yeah, I mean, from the policy perspective, I can't speak to that because ours did not get implemented, right?
Exactly.
With us, with the teens, I mean, what I think was the advantage of the approach we took is that it was the stuff that they were seeing and capturing on their own. So there is no way to sort of have an industry conversation back about the fact that it wasn't directed at them, or it wasn't, they didn't see it, because they're actually capturing it in real time and then uploading it. So.
Yeah, I think I was a question for you all. Because that's the one, and you touched upon, some of you at least, the role of influencers, not so much the adverts, but the influencers who are, well, somehow paid, or we don't know whether they are paid actually. How do we deal with this? Jean, maybe I can give you the word first.
Yeah, I had to go at trying to answer that. I think I think the suggestion that's made in the chat is we just keep people who are not specialists in nutrition off social media, which obviously we've we've all kind of
I would
proposed
love that, but okay. Yeah.
But I haven't ever heard it said kind of seriously. And actually, it raises two thoughts to me. Firstly, like, can we police who's a specialist in nutrition? Like, don't have a degree in nutrition, so maybe I'm not a specialist, but also certainly have, I don't know if I'd call them colleagues, like I know professors on saying things on social media that maybe would rather they didn't. But like, apart from that, I think that we've done a little bit of work on, I'm sure Charlene knows much more about this than I do, about where people get their information from and why they engage with nutrition content online. And I think there's a real desire amongst people. Nutrition information is really complicated. They want some simple answers on how do I feed myself and my family well, affordably, ethically, if I'm concerned about the environment. And that's why they look for people who have stories to tell them. Influencers share their personal experience. It's very engaging. And I sort of feel that like that's the problem we need to solve rather than there's people pushing nonsense. We maybe need to address like, well, how can we help people eat well on a budget? Day in, day out. It's a big challenge.
I'll come back to that. Charlene, can you add to this?
I would add to that. I mean, I think you're right on point. One of the big challenges, I think, is the need to provide people with critical media literacy skills when it comes to navigating these kinds of messaging. I mean, not only for advertising alone, but then taking a look at the influencer content. Because again, yes, it is logistically quite difficult to suddenly say that an influencer can't give nutrition, not like, where's the manpower to actually be surveying all of these influencers and everything they say and assessing whether it is, valuable or invaluable or problematic or not. So to me, I think that one of the things that we could really push towards is that, development of critical media literacy in teens, in children. We're certainly doing this with a program we've developed for kids on trying to get them to understand persuasive messaging, understand how they are being persuaded, why that is appealing to them, to try and give them those skills. I mean, again, it's interesting because one of the comments in the chat was also about framing it around obesity being problematic, right? And could this cause problems, with individuals? And I think that, to me, I'm answering this because there's a difference between putting forth a policy to prevent obesity versus putting forth something to promote health. And what we're really trying to do is promote health. And I think everybody can get behind promoting health and giving people skills to understand how they're being persuaded, what are the techniques that are being, to try and create that sort of armor where they can critically assess what's going on, is really helpful in terms of kind of providing a response to the current environment, particularly when it comes to digital.
And do you think then, because I also try to make a link to a research gap, Charlene, do you see that there's also a research gap to develop this type of media literacy educational programs or changes in?
This is something we've done out of our program, particularly for kids, like younger kids, and it's interesting because some of the comments that I get back are along the lines of, well, it's parents who are making the purchasing decisions, so why are you focusing on kids? And I always think that, these are skills that children are going to use across a lifetime. So being able to have these critical media literacy skills, is something that they're going to use now. It's going to use it in the future. So I really think that is an opportunity. And it's not, I guess, giving up on policy and the obligation of policy to protect young people. That is not what it is. So, I mean, I'm not, like jumping ship on that. I think the policy is incredibly important, but I also think equally important is to, educate individuals. And what we have found with kids and with teenagers too, I mean, they're smart and they're savvy. They just need to have it pointed out to them, and they very much appreciate it having pointed out to them, because nobody likes to be manipulated, and you don't like to be manipulated if you're a teenager. You don't like to be manipulated if you're a child. And the other part I would also say, with the focus groups we've done with teenagers and the interviews we've done with teens, is they're very cynical about marketing. But just because they're cynical about it doesn't mean they're not persuaded by it. So cynicism,
maybe they don't recognize it.
It's not a shield against persuasion. And so I think that what you're having to do is provide them with, again, some of the strategies to actually recognize it, and then to work with it in a meaningful way.
I want to change gears a little bit, because there is also some comments, and I want to, with Olga first, about a definition of food and drink aimed at children and front of pack labeling, especially for children. There was and whether WHO was able to come up with a global nutrient profile model. So I'm going to Olga, because these questions are first based to you, I think. A global nutrient profile, is that possible? And then how do we have this, and especially made a nutrient profile for children? Do we need that actually? But it is a question in the chat.
Thank you very much. So indeed, when we develop definition and regulations as well, it's important to know what is healthy and what is unhealthy. And the easiest way which countries use at the moment is the nutrient profile model. It doesn't really make sense to have a global nutrient profile model, because it's based on specifics of particular foods which are prevalent in specific countries and areas. And since WHO has 6 regions, every specific region, like WHO EMRO, WHO Europe, WHO, etc., WIPRA, they have their own models. Yes. So, and then the second question was about, sorry, Edith,
especially for children.
For children,
how do we discern?
So we have a special nutrient profile model for marketing, and it includes that.
Okay. Anybody else of the other three speakers, something to add to that? Otherwise, I go to a final question. I don't have much time, yes, right? We almost have to close. Well, maybe I ask you, each 4 of them. Liv, what is your research recommendation or research to policy recommendation?
Well,
I will ask you, all of you, so you can think about it, other speakers.
Yeah, I think it's important to study how to create policies based on the evidence and the policy guidelines and so on. And Norway is one example. Can study why it works in some countries and not in others, and and also study the implementation. I think now we have enough knowledge about the exposure and the consequences and so on. So
I have one as well. But first, Charlene, what would your final recommendation be?
I actually would echo what Liv said, because quite frankly, we've got the evidence, and so now we're still collecting more evidence. How do you move it forward into action?
Yeah. Jean?
Somebody put something in the chat about what do we learn from tobacco control.
Yeah.
And I think coming up with a strategic response to food marketing that's more than just a collection of individual policy restrictions is kind of the next step, next big question.
Yeah. Olga, your final recommendation?
Thank you. I think, of course, it's important for governments to care about the environments where children live, and but I agree with Charlene and Jean about literacy, and obviously we need literacy everywhere, like in finance, in digital spaces, etc. But yeah, my last comment would be that governments and researchers should work together to lobby the regulation.
Yes, my final remark, if I listen to this, I very much agree with the evidence that's there. And as a professor, I always think in nutrition, we should also teach our students how to work on implementation and understand implementation processes better. And that is something I learned also from this, I think, and building bridges is also important as a nutrition scientist or a nutrition student. And well, we need all of that together. Well, with these wise words, I'd like to close this meeting. Thank you very much, all the 4 speakers, all the attendants at the max. We had more than 150 listeners, so that's really a very great attendance. Still 92 people joining. In the Q&A, speakers, you can take a look if you are willing to. Or do we need to close, Juliana? I think most of the questions we were able to answer one way or another, and otherwise everybody is clever enough to reach out to you personally by your email address. So thanks again also Juliana, HDHL, and Mario Markachuk from the Canadian Institute for Health Research for providing all these possibilities. And remember, the 21st of April, we have a very, very nice symposium in Brussels. Don't forget to register. And see you hopefully there. Thank you very much.
Thank you very much, Edith.
Thank you. Bye-bye.